everyone. Today we are going to talk about the career of dental hygiene. Let's get to it. What is dental hygiene? A registered dental hygienist is a healthcare professional who care for your entire mouth. While dentists normally repair damaged teeth caused by either trauma or disease, hygienists specialize in protecting and preventing disease in the first place. Many times, people assume that hygienists just clean the teeth, but their role in healthcare is much more important than that. Hygienists need to be educated in many areas of science such as anatomy, chemistry, pharmacology, pathology, microbiology, radiology, periodontology, and many more. There are many roles and career paths that a dental hygienist may have. A clinician is where a hygienist works in a dental office and has many duties. These duties include taking x-rays, performing exams, scaling the teeth to remove hard deposits such as calculus, polishing to remove plaque and stains, as well as educating their patients on their oral health. Hygienists can also become educators. These educators are commonly found in colleges with dental hygiene programs. Their duties include teaching future dental hygienists in both theory and lecture in the classroom, as well as the clinical setting. The dental field is constantly growing, and therefore more new ideas are being developed, so hygienists are also able to work in research to help discover new ways to improve patient treatment. They can participate in clinical trials, as well as write scholarly articles on new and improving methods to improve patient treatment. Office positions, otherwise known as administration positions, are also available to hygienists. Some of these positions are found in colleges. For example, the Dean of Students for healthcare programs like the dental hygiene program is an administrative position. Other agencies for dental care also have administrative positions available. Their duties include maintaining and managing these programs for which they are working with. Dental hygienists are also able to become advocates for people with low socioeconomic status, such as low-income or homeless individuals, people with disabilities, and people with existing diseases or illnesses. The duties of an advocate include publicly supporting and recommending dental hygiene treatment. Similarly to advocacy, public health dental hygienists work with agencies to provide access to dental care to the public and local community in places such as nursing homes, schools, and clinics, such as clinics in local health departments. Their duties include promoting the public's health by combining many roles that a dental hygienist has into one to protect the public in preventing oral diseases. Some of these career paths require more schooling and education, and therefore bachelor's, master's, and even doctorate degrees are an option for those interested in advancing their career and knowledge.
Today, I will be sharing the perks of dental hygiene, starting with education. It only takes 1.5 to 2 years for your prerequisites and 2 years of dental hygiene school. The best thing about education within the dental hygiene career is that you may always go on to continue your education. A lot of people who decide that they would like to go on to become professors or teachers within a dental hygiene school can go on to get their bachelor's, master's, or PhD. Then, with our salary, the U.S. Bureau of Labor and Statistics has decided that the median pay per dental hygienist is about $76,910. Now, this is considered the second best paying job, requiring only an associate's degree. Not only that, but we have a lot of flexibility within the dental hygiene career. You can decide to be full or part-time, you can do weekends, or you can do no weekends. Not only that, but there are no holidays. The dental hygiene career is also considered a very high demanding and a fast-growing career.
Hello, Abby. My name's Kristen, and I'm going to be your hygienist today. What brings you in?
I'm just here for a cleaning.
Okay, awesome. Let's just go over your health history real quick. Have there been any changes?
Nope, no changes.
Okay, I see here that you use nicotine products. Is that still true?
Yes, I vape.
A lot of teenagers in this day and age are being exposed to nicotine in many different ways, whether it be smoking cigarettes or using different types of vapes like Juuls or chewing tobacco or nicotine gum. Many people are aware of the systemic dangers and health issues that come along with using these products, but don't always think about the damage it causes to their oral health. Once someone starts to use these products, specifically vapes or Juuls, they can easily become addicted. When a person becomes dependent on nicotine, their brain and body becomes used to the substance and it gradually gets harder to go without. When a person becomes addicted to nicotine at a young age, it increases their risk of becoming addicted to something much more worse later on in life. Along with the dangers of addiction, a person can experience nicotine withdrawals when they have gone too long without it, or if they are trying to quit. These withdrawal symptoms can include unpleasant physical and mental feelings, which make the person want to use nicotine even more. When a person uses vaping products for a long period of time, they will have an increased risk of acquiring irreversible lung damage or lung disease. A person also has an increased risk of developing a respiratory and/or heart disease. Along with these risks, their oral health is also highly influenced by these products.
When a young adult inhales the nicotine from a vape, this can damage the cells that your gums are made of. Nicotine also causes blood vessels to squeeze, cutting off blood flow to the area. When a bad bacteria invades your mouth, your immune system has a harder time fighting it off because of the decreased blood to the area. After a while, more and more bacteria show up, causing the infection to get even worse. As it progresses, the infection worsens, causing gingivitis, reddening of the gums, and recession of the surrounding teeth. The tooth roots become exposed, and when this happens, cavities can form on the tooth roots. The infection also has started to affect the bone that creates holes in the teeth. Eventually, the bone wears away too much, and the tooth can become loose, fall out, or need to be pulled out. Now there is a missing tooth. To replace the gap in the teeth, there are options such as dental implants. However, they can be very expensive and painful.
This is why it is so important as a dental hygienist to show and educate their patients about the damage caused by nicotine products. Hygienists don't need to sit and lecture their patients about why vaping and even smoking is bad for them, because chances are they already know that they're causing damage to their overall health and oral health. But a technique called motivational interviewing is usually a much softer approach to the subject of quitting, and it's a patient-centered counseling style made to guide positive behavior change in the patient. A hygienist's job is not to force every patient to quit smoking, but more so to educate them on the negative effects. If they respond with a definite no and have absolutely no desire to quit, then the subject should be dropped. But if the patient is listening to what the hygienist is saying or expressing feelings of wanting to quit, the hygienist should have many ideas in mind that could help their patient achieve their goal of quitting. Giving patients a pamphlet or an outside resource to a quitting program, or giving them alternative options to using nicotine, or any tips in general that may help them quit can start the process of quitting. At this point, the hygienist could even offer to call the patient every couple of weeks to see how they're doing, or if they need extra help to quit. There are many different ways that a person can quit using nicotine products, and it typically takes about 20 to 30 tries on average for a person to truly quit smoking.
You're due for some x-rays, so we'll take those now.
Okay.
All right, we are all done with your x-rays. So now that we are done with your x-rays, I'm just going to perform a series of exams just to get an idea of the current state of your mouth.
Okay.
Now that we've completed the initial exam, I just wanted to go over some information that I found. From my findings, it seems that you do have some gum recession and some bone loss. Now, because you told me that you vape, it's my job to let you know that that could be a cause of some of this recession and bone loss. See, nicotine is a very powerful substance, and what it does is it causes the blood vessels in your mouth to squeeze, and because they do that, it cuts off the blood flow to the area. So when you have a normal everyday bacteria come into your mouth, then your body can't fight it off as well, and then that can just increase the likelihood of damage it can cause. We call this bone loss periodontitis. So with periodontitis, the reason it is so bad is that once bone is gone, it doesn't grow back, so it's gone forever. And the most that we can do is just stabilize the condition so that it does not get any worse. That's why you come and see me, so that way I can reach the areas that you don't normally reach with your toothbrush and your floss, and then we can get the infection under control.
Wow, I never realized that vaping had such a negative effect on my mouth.
A lot of people don't, and that's why I'm here to inform my patients on some of these things. Have you ever thought about quitting?
I have, but it's very, very hard for me.
I know it is, and if you're okay with it, I have some resources and information that I can give you to help you in your journey to quit.
Yes, I'd really appreciate that. Thank you.
You're welcome. Anything I can do to help, even if it's a week or a month from now, you can just give me a call and I can help you.
Perfect, thank you.
Now let's get to the cleaning you came in here for. So now that we've learned all about the career of dental hygiene, let's answer a few questions. Number 1, what duties do dental hygienists have besides cleaning the teeth? 2, what other job options are available to registered dental hygienists besides working in a dental office? 3, how many years of college is required to become a dental hygienist? 4, when it comes to vaping, what is a good indicator that the teeth and mouth are being affected negatively? And 5, why is bone loss so bad? And here are the answers. Number 1, dental hygienists can take x-rays, perform exams, and educate their patients on their oral health. Number 2, registered dental hygienists can be educators, researchers, administrators, advocates, and work in public health. Number 3, it takes 1.5 to 2 years of prerequisite classes and the completion of a dental hygiene program to become a dental hygienist. Number 4, gum recession and bone loss are both indicators that vaping may be affecting the teeth and mouth. And number 5, bone loss is so bad because bone does not grow back. Once it is gone forever, and some of these procedures to replace missing teeth can be expensive as well as painful. We hope you enjoyed our video and that we've inspired you to consider a career in dental hygiene. Thanks for watching.